Good evening. Kidney stones are hard deposits made of minerals and salts that form inside your kidneys. Kidney stones may have many causes and can affect any part of your urinary tract, from your kidneys to your bladder. Often, kidney stones form when the urine becomes concentrated and allowing minerals to crystallize and stick together. To know more on kidney stones, today we have with us Dr. V. Mohankumar, consultant urologist and robotic surgeon at Apollo Specialty Hospitals, OMR. Good evening, doctor.
Good evening, ma'am.
What are kidney stones or Siraniraka Karkal?
Kidney stones, usually generically we call it as kidney stones, but kidney stones are stones which form anywhere in the kidney, or it can come and drop in the ureter, or it can even be seen in the bladder. It's a urinary tract stones. There are a lot of reasons for formation of kidney stones. The most important reason, as you told in the beginning, is that crystallization of the minerals, which leads to formation of the stones.
What are the signs or symptoms of a kidney disorder?
Yeah, the thing is, it depends on where the stones are. The stones, if they are in the kidneys, it might not cause an acute pain. It can have a dragging pain, and the patient, if the stone is infected, the patient can have fever and a very little dragging kind of pain and a nagging pain. But if it is in the ureter is a small tube which connects the kidney and the bladder. If the stone drops to the ureter and it blocks, it can cause excruciating pain and severe nausea, vomiting, and pain in the flank region. And the patient, if there is bilateral stone, the patient can even have complete drop in the urine output. And if there is any stone in the bladder which is dropped to the bladder, sometimes what can happen is the patient can have problem while passing urine. So these are the symptoms. The symptoms depend on which part of the urinary tract the stone is in. It depends on whether it's in the kidney or the ureter or the bladder.
And who is at a risk? Who's at a major risk of developing kidney stones?
It can affect anyone between. It can even affect the infant or toddler, and it can affect a person even of 80, 90 years. Age is not a bar. Even sex is not a bar. The thing is, once a stone former, always can be a stone former again. The risk factors of stone are lifestyle. The thing is, like a lot of things we take, as in the fast food, Coke, Pepsi, all these things can lead to stone formation. And people who don't drink water, adequate amount of water, especially in a hot and humid condition like India, in a tropical country like India, where we are exposed to extremes of temperature most of the year. So these things are very important. You need to take a lot of water. People who don't take water, people who have a lot of fast lifestyle, all these people are prone for stone formation. And apart from that, there are certain metabolic abnormalities, there are certain hereditary reasons also being investigated for stone formation.
And how do we prevent kidney stones, doctor?
The prevention, the most important factor in preventing the stones is drink a lot of water. Lot of water in the sense, like, at least people think that, I drink 3 liters of water, 2 liters of water. Lot is how enough is enough. We say that, the amount of water you drink is not that important. The amount of urine you pass is important. For example, if you take in summer season, for you to pass about 3 to 3.5 liters of urine, you need to consume at least 4 to 4.5 liters of water. But whereas in winter, for you to pass about 3 liters of urine, it's enough if you consume 2.5 to 3 liters of water. So the most important thing is the amount of urine you pass. So you'll have to titrate your intake according to the climate. One thing, and the other thing is to avoid any food substances which can lead to stone formation. People feel like, there is a common myth which people say that calcium, drinking a lot of milk, calcium and all those stuff leads to formation of stones. No, it's just a myth. It's not correct. Calcium taken in a proper way, it actually prevents the stone. For example, what happens is if you take calcium along with the food, what causes stone is the oxalate. If you take calcium along with the food, what happens is calcium prevents the oxalate absorption from the intestine and the stomach. So what happens is if you take adequate amount of calcium with the food, it can even prevent the stone formation. So moderate to normal amount of calcium with low sodium and low protein diet is the ideal diet to prescribe for prevention of stones.
Hello, doctor. I have a 7.8 millimeter kidney stone, and the stone does not pass out even after drinking plenty of water. What should I do?
It depends on where this, in the sense, like, what is the modality which detected your stone? For example, if it's a CT scan which is detected a 7.8 millimeter stone, it means that the size is accurate. And where in the kidney is the stone? For example, if it's in the lower calyx, 8 millimeter stone, if it's not causing any pain or something like that, we can as well leave it as such. But if it is a pelvic stone, if it is causing the obstruction, or if it is painful, we can remove the stones. And it also depends, the method of removal also depends on the hardness of the stone and location of the stone. If it is in the lower calyx, it might be a flexible ureteroscopy. If it is in the pelvis, we can even use a modality called ESWL, where the stones can be blasted without any surgery from outside. If you ask me whether 7.8 millimeter stone is definitely needs to be removed, no, not in all circumstances. For example, there are certain professions where even 5 millimeter stones need to be removed. For example, if it's a pilot or a marine or a ship captain, we will never let any stones be inside the kidney, because their stone renal colic might be hazardous to lives of hundreds of people at any given point of time. If it's a normal profession, normal people like us, 7 to 8 millimeter stone, if it is not causing any trouble, we can just leave it as such.
Hello, doctor. I had stones in one of my kidney 4 years back, which was 4 centimeters, and I haven't got any pain after that, after my treatment. Even during the scan, it's not seen. Has it come out? I'm doing good, no pain at the moment.
Unfortunately, 4 centimeters, I feel like what you would have told is 4 millimeters. 4 centimeter stone is a big stone. You have to anyways remove it. If it's a 4 millimeter stone, I think it would have passed by the ureter, or sometimes 4 millimeter stones on sonography might not be that accurate. It might be even a small 1 or 2 millimeter stones might have appeared like a 4 millimeter stones. It's better you get a sonography done. If you repeat sonography done, if you have a stone, then we can do a CT and find out.
You spoke to us about symptoms. Once I get any of those symptoms mentioned in your talk recently,
Yeah.
what would be my expectation out from my urologist first appointment?
So first appointment, what they do is like they will assess your symptoms. As a urologist, I would like to know your previous history, if there are any stone diseases, or your family history, and most importantly, if you're in severe pain, I would first like to get rid of your pain by giving some injections, and then I get a basic sonography done. A sonography and an X-ray will give you an approximate measure of where the stone is, what exactly is the size of the stone, and whether it needs to be treated or not. If it's a small stone, we don't do a CT usually. But a small stone which can be seen on sonography, and if it is, the symptoms are less and the infection is less, we'd give an antibiotic, we'll give a treatment for stone expulsion, and then we will review him later after a week.
I've been having urination problem for over a year now. It starts with a weak stream and ends in a drip, and it sometimes hurts. I go frequently day and night. I'm 23, male, in Chennai. Should I visit a urologist? Please advise.
Yeah, you should visit a urologist, because young male with urinary complaints of the flow related complaints always should visit a urologist. You might have a stricture, or you might have a small block in your urinary passage which needs to be evaluated. You cannot take things lightly, because you are a very young male with people with in this age should not have urinary complaints, because this is not the age for prostate. If it's 60 and above, we can think in terms of prostate. 23 years is not the age for prostate. You might have some block or any small stricture or something like that. We need to evaluate you. You should visit the urologist.
What are the treatment options for kidney stones, doctor?
There are a lot of treatment options, ma'am. It depends on where the kidney stones is, what is the size of the stone, and how hard is the stone. There are a lot of treatment options where the options available are ESWL. ESWL means extracorporeal shock wave lithotripsy, in which we don't do any surgeries, we don't even do endoscopic surgery. We blast the stone from outside. The types of stones which are amenable to ESWL are small stones, renal pelvic stones, and less than 1 centimeter stones. The stones are soft. If the stones are hard, if it is around between 1 to 2 centimeters, even though the stones are soft or hard, we have an instrument called as flexible ureteroscopy here, where we don't have do a cut or small hole also. We go through the normal urinary passage, use a special scope which bends. We go inside the kidney and break the stone with the laser and remove the fragments. There might be really big stones, more than 2 centimeters, which are hard. These type of stones are not amenable to flexible ureteroscopy. In these circumstances, we use a modality called as PCNL. You guys would have heard about it. PCNL is percutaneous nephrolithotomy, in which we make a small hole through the back of the kidney, which is the size of a pen, and we go through that and we use this nephroscope and break the stones with laser or lithotripsy and remove all the fragments. So these are the modalities available.
Which is better, doctor? Percutaneous nephrolithotomy or flexible
Yeah, it
scopy?
depends. It depends on the nature of the stone, the size of the stone, and the site of the stone. If it is a small stone, I will always go and do a flexible ureteroscopy. If it is a big stone, if a patient needs complete clearance in a single stage, then PCNL will be better. We offer all kinds of stone removal modality treatments here in Apollo, Chennai.
I have a stone in my left ureter, 5.2 mm. How can I remove it by natural way, or is surgery the only option? In the report, it is the left lower ureteric calculus with the resultant mid-back pressure changes.
Yeah. In this report they have given there is some back pressure changes. It means that the stone is a bit obstructive. Even if it is 5 millimeter and it is in the lower ureter. I wanted to know how many for how many days you have this stone. For example, if it is a stone, a patient comes to you with a stone history of only 2 week or 10 days, 5.3 millimeters stones. How we divide is like in the lower ureter we divide stones as less than 4 millimeter, 4 to 7, and greater than 7 millimeters. If the stone is less than 4 millimeter, the chance of it passing by itself with treatment is more than 80%. Your stone falls in the category of 4 to 7 millimeter, 5.4 millimeter. What we can do is like we can give you a chance of medical expulsive therapy, which helps in a removal of the stones. We can give you the treatment for about 2 weeks or 3 weeks, and we can repeat a sonography again. You have a chance of passing the stone spontaneously for about 50 to 60%. There's a 60% chance that you might not require surgery and the stone might pass itself. But at the end of, very important thing is at the end of 3 weeks, you need to consult a urologist again, because some stones might be in the ureter and might not give any symptoms. So it's very important for you to take the medicines and visit a urologist after 3 weeks and do a repeat scan. If the repeat scan shows the stone at the same site, then we might go for surgery.
Why are we born with 2 kidneys if donating one doesn't affect our lifespan?
That's a very good question. Thing is, I don't have an answer to that question actually. 2 kidneys are essential. 2 kidneys put together will help you in sustaining the life for a longer time. It doesn't mean that if you donate a kidney, your lifespan reduces. It doesn't mean like that. There are a lot of about 1 to 2% of people in our population are born with 1 kidney congenitally. So even that, even with 1 kidneys, if we take care properly, people live their entire lifespan.
Is surgery required for a 5 millimeter kidney stone?
That's a good question too. It depends on where the stone is. If it's in the kidney, 5 millimeter stones, it does not require surgery. If it is in the ureter, if it's causing symptoms, it requires surgery. And it also depends on what profession the patient is in. If it's, as I told you previously, if it's a pilot or a ship captain, even 5 millimeter stones require surgeries. If it's a patient, it's a sedentary lifestyle or any other profession, then it does not require. It depends on where the stone is it symptomatic or not, and based on the profession also.
Hello doctor, I'm 37-year-old male suffering from left upper ureteric stone and right renal stone, small size. Treatment at the moment is tablet Aquazide 25 of liquid K-Cetine 15 ml twice, tablet Veltam 0.4. Can I continue this? Do I need a second opinion?
Yeah, you can continue the medication. The medications given are correct, but the thing is, because it's an upper ureteric stone, you might not. What I advise is, as I advised before, you continue the tablets and get a scan after 3 to 4 weeks. If the stone is still in the same location, then you might require surgery.
What are the myths related to kidney stones, doctor?
Myths related to kidney stones, as I told you before, is like if you drink hard water, the stone forms. If you drink a lot of calcium, the stone forms. The stones might. If your partner has a stone, you will get a stone. All these things are myths. I will burst one myth after the other. First thing is calcium. As I told you, calcium taken in a proper way along with the meals actually is protective if it's taken in a normal quantity. Excess of anything is bad. And the second myth is like stone disease is not an infective disease. So the reason for a person in a family, for example, people will say that, doctor, my father has a stone and I have a stone. My wife also sometimes, she's also found to have a stone about 5-6 millimeter. Is it infectious? No, it is not infectious. It says that, the water, the food, the diet you're taking and the amount of thing you're doing as a collective, as a family is to be changed. For example, people have to take a lot of water. if they don't take a lot of water, if you live in a tropic climate, for example, places in Madhya Pradesh, Rajasthan, are called as stone belts. Stone belts in the sense like the place in which every household has got a stone, a person has got a stone. So it depends on the place. It's got to do with the stone, the area, and the location.
How do I remove my kidney stones naturally? This is a very common question asked by many of our viewers.
See, kidney stones naturally, it depends on the size. If it is less than 5 millimeter, we advise you to take a lot of water. And if it is a soft stone, for example, soft stones or uric acid stones, these stones can get dissolved, or the size can reduce if you alkalize your urine. So, for example, you can have a lot of alkalizers and a syrup called potassium magnesium citrate. All these things can help in reducing dissolving the stones. But as of now, we don't have a definitive therapy which can say that yes, if you take this 100%, the stone will get dissolved. No, we don't have that.
Hello, doctor. I'm a 36-year-old male having pain in the lower left abdomen, diagnosed with left mid-ureteric calculus with mild hydronephrosis and hydroureter calculus sizes 6.6 millimeters. Right renal small cortical cyst. Post-void residual is at 92 ml. Kindly advise.
The advice is like, I wanted to know your age.
36-year-old.
36 years. Post-void, a single post-void is not that significant. The one which worries is the stone which is in the mid-ureter, is about 6.5 mm. I need to know the duration of your disease. For example, if you're already, this scan you've already taken 3 weeks ago, I would advise you to go and take a sonography again to see whether the stone is still there or not. If the stone is still there, and if you have not taken any medications, you can visit a urologist and take the medications, because a stone about 6.2 millimeters, it has got a 30-40% chance of coming out spontaneously. If you have not taken the medications, you take the medications. Even if the medication, after repeat sonography, if you feel that the stone is still there because it has come in the ureter and it has blocked it, I would advise you to visit a urologist and get the stone removed.
What is the significance of robotics in urology, doctor?
Robotics in urology, usually we use robotic surgery when it's oncologic, in cancers. For example, in, prostate cancer, kidney cancer, and bladder cancer. All these type of cancers can be treated well with robotic surgery. Robotic surgery adds to the precision precision of the surgery, and the recovery is amazing. The recovery is very early. We at Apollo Hospitals offer robotic surgery for all kinds of urological oncological procedures. Even in stone diseases where there are certain stones, if it's a complete staghorn stone, there is one procedure called as anatrophic nephrolithotomy. We also have expertise in using robotics for those type of surgeries, stone removal. But simple stones, robotic surgery is not necessary. But if it's a very complex staghorn stone, which has to be removed by open surgery, then robotic surgery is the way to go.
Can you tell us a little bit about the Department of Urology at Apollo Specialty Hospitals, OMR?
The Department of Urology at Apollo Specialty Hospitals, OMR, is equipped with all kinds of latest technology. We treat patients right from pediatric age group till 80-90 years. We have expertise in treating all types of stone diseases, even complex stones, and laparoscopy. We even offer robotic surgery, and we do renal transplantations too. So it's a one-stop solution for all your urological problems.
I am a 62-year-old man. The scan report of mine shows splenomegaly, cortical cyst with punctuate wall calcification in the upper pole of the right kidney, type 2 cyst. Right renal calculus, no radi dense ureteric calculus, multiple small calcific as well as non-calcific nodes in the right lumbar region. Kindly advise.
So splenomegaly, you need to visit a physician. For these cysts, you need to be on regular follow-up. For the renal calculus, I think we need to assess you further. It is not an emergency because it's not a ureteric stone. We need to see this CT scan report, and then we need to take the things forward. For example, if the cyst is not coming in the way, we can either, for the stone, if it is symptomatic, we can do a PCNL or a percutaneous nephrolithotomy. If there's a big cyst and all that, the stone is small, then we can as well remove the stone by flexible ureteroscopy.
Do women also develop stones in kidney, doctor?
Yeah, women also develop stones in the kidney. doesn't differentiate. The stones doesn't differentiate.
And the treatment methodology
Treatment
is the
methodology
same.
is the same.
Can you let us know about kidney stones in children?
Children, there are a lot of reasons for developing kidney stones in children. It might be hereditary. There might be a lot of metabolic reasons for renal tubular acidosis. Patients can also develop stones in children. Treating a kidney stone in children is very, very tricky because a lot of instruments are developed only for treating stones for adults. Here in Apollo Hospital Zoema, we have special instruments with which we can treat the kidney stones even in children. We have miniaturized instruments and small flexible scopies with which we can go and treat the stones in the children. Children, treating the stone is very important because it's just not enough if we treat the stone. We need to find out the root cause. Because in children, if you just treat the stone, what happens is the stones might form again and again. So we need to assess the root cause and we need to do the evaluation completely. We need to find the metabolic reasons for the stone and treat the root cause to prevent the formation of stone.
Hello, doctor. I want to know, does Silofast 8 mg help dissolve kidney stones of 5 mm in kidney ureter junction?
No. See, the thing is, this is a good question. Probably the doctor who would have given this, Silofast is an alpha blocker. Why they would have given is like they would have given this to aid in the expulsion of stone. These drugs, alpha blockers, don't help in dissolving the stone. What it does is it just opens up the passage and loosens the uretrovesical junction so that the stone will pass freely without causing a pain. It will aid in the expulsion of the stone, not in dissolving the stone.
Can you tell us about one of your challenging cases, doctor?
One case, what we had was like a patient very recently we operated. He was operated outside, and he's a patient with a horseshoe kidney, and there was a stone in the horseshoe kidney. It was attempted surgery outside, and surgery was not possible. When he had come to us, what we did was like we did a CT scan and we assessed it, and somebody has advised him open surgery. But what we did was like we did a simple flexible ureteroscopy without any scar, without any cuts. We completely cleared the stone in a single sitting and sent him home in a couple of days. And he was very happy because he has been visiting doctors, a lot of doctors with this stone for nearly a year and a half. A lot of people were reluctant to take the case, but we took this as a challenge and we operated and we sent him home in a couple of days. That was a very satisfying experience.
Hello, doctor. My kidney measures 106 into 59 millimeters. There is a mild dilation of the right pelvical system with a dilated right upper two-third ureter with small right mid-ureteric calculus, which measures 6 into 6 millimeters in size. What does this indicate? Is it something serious? Can it be treated?
It is not serious, but it is a thing which needs some consideration. Because the stone is there in the ureter and it is causing some obstruction, I think this is the sonography. You need to do a CT scan to know the exact size of the stone and the nature of the stone. Since the stone is in the mid-ureter, I don't know for how long you've been having the stone. If it has been for more than 3 to 4 weeks, I better advise you to go for a CT scan and visit a urologist. There's no point in waiting for more than 3-4 weeks. We can do a simple ureteroscopic procedure and make you stone free. It has to be treated. It is not an emergency, but it has to be given consideration, and you need to visit a urologist and get it treated.
What happens when a kidney disorder goes unnoticed or undiagnosed?
Because kidney stones, we have had patients who have bilateral stones, and what they do is like, because people think that only if you have symptoms you should visit a doctor. No. For example, even if it's a big stone, sometimes people might not have symptoms, so they don't go and get it treated by the urologist. The stones stay there. Sometimes the stones might come and block the ureter, and the kidney can get infected. We have seen patients who have a completely asymptomatic stones, and the kidney going into complete failure, and even requiring a kidney removal. So this is how bad untreated stone can turn out to be for the patient.
How are kidney stones related to renal colic, doctor?
A renal colic is the sense like it is the pain which the patient suffers. That is colic. Kidney stones, if it is a big stone, it can stretch the kidney capsule and cause pain. If it's a small stone comes and if it blocks the ureter, then also the patient can have pain.
Hello, doctor. I'm a 42-year-old male. During urination, I have very heavy pain in the urethra every time. This is almost there for the last 10 years. But today I saw some blood drops in the urine. Is it serious? Because I'm really scared. Please advise.
This is not related to stone disease probably. You might need to visit a urologist and get a evaluation done. For example, if it's 42 years, you might have a stricture or any small stone or any other problem. So we need to evaluate you in terms of sonography and a uroflowmetry and assess your symptoms thoroughly. You need to visit us. You need to visit a urologist.
You've spoken about the measures to prevent a kidney disorder. Could you elaborate a little bit about it?
Exactly. See, science has grown over the last few decades, but all the growth is in terms of only how to treat the already formed stones. Science is still in the infant stage when it comes to prevent stone disease. We have done a lot of research in India, and we are still doing a lot of research in preventing the stone diseases. What we have found out is people who the most important things for prevention of stone is you drink a lot of water, one important thing, and you avoid. There are certain foods which you can avoid, which contains which results in stone formation. There are certain simple measures you can take to drink a lot of water, to drink citrus juices, for example, lemon juice, orange juice. All these things will prevent formation of stones. So there are very, very simple basic measures which you can take to prevent the stones.
What are the foods that should be avoided and what are the foods that should be encouraged to avoid?
It depends on what type of stones you have. Most of the stones will form in an acidic environment, urine acidic environment. You need to alkalize your urine. You need to alkalize your urine. And there are certain stones which form when you have oxalate containing foods. Oxalate containing foods in the sense for example, tomato, palak, nuts, dark chocolates, Coke, Pepsi, and all those stuff. There are almost all the foods contain oxalate. If I say that you avoid oxalate containing foods, a lot of people come and say that, doctor, if I went and saw in the net, almost all the food contains oxalate. So I cannot live with only drinking water. No, what we mean is nothing like that. What we say is avoid food which contain oxalate to a larger extent. For example, spinach, for example, tomato, palak, and all those stuff. You can take citrate containing juices, for example, lemon juice, orange juice, all these things contain citrate, which will help in reducing the stone formation. But this is the general advice we give, but it all depends on what are the stones. There are lots of different type of stones. So for example, if a patient brings a stone to us, we can analyze the stone already passed, we can analyze the stone, and we have facility to even analyze his urine and see what are the salts the patient excretes in the urine. And if based on the amount of magnesium, citrate, uric acid, oxalate, and all these things in the urine, we formulate a diet for the patient, and we make sure that if the patient follows a certain diet, his chances of forming the stone reduces to a great extent. It can be tailored, it can be individualized according to the patient's needs.
Speaking of foods, there is a theory which says that you're supposed to avoid the seeds in the fruits and vegetables. Is it true?
No, it's not true.
Especially in tomatoes, guava.
It's just a myth. No.
Thank you very much, Doctor. That was really an informative session.
Thanks a lot.
For appointments with Dr. Mohankumar, consultant urologist and robotic surgeon at Apollo Specialty Hospitals, OMR, please reach out to 729990 99985. I repeat, 729990 99985. Thank you, Doctor. Thank you, viewers.
Thank you.